You are listening to Lone Star Community Radio on 104.5 KCZWLP Conroe and 106.1 KZCCLP Conroe, and worldwide on irlonestar.com.
Thanks for visiting our archives for the Hispanic Chamber Connections radio program with Dr. Carlos Sanchez, president of the Woodlands-Conroe Hispanic Chamber of Commerce. Remember, we are live on Lone Star Community Radio every Tuesday from 1 to 2 p.m. If you have any questions, just reach out to us at the link below.
Worldwide, this is Dr. Carlos Sanchez with the Hispanic Chamber Connection, and welcome to the big show. We have a great program ready for you today. Hope you're listening. I hope you're taking note, because 1488 Family Medicine is in the house, and we're going to talk a little bit about Dr. Groning and about some of his services and about some of the things that the clinic is doing. We're here with Leslie Guzman and with Lance Aaron, both of whom work with the clinic, and they'll talk to us a little bit about some things that they're offering this summer and that they're going to offer once the school year begins and things like that. Before that, though, as always, remember that this program is for members of the Woodlands-Conroe Hispanic Chamber of Commerce. It's also for members of the Katy Hispanic Chamber, of the Vintage Park Hispanic Chamber, and of course, the Galleria Hispanic Chamber, all of which form one family of chambers of commerce. And the mothership, as it were, is called the Texas Gulf Coast Hispanic Chamber of Commerce. That is the 501c6 under which all these chambers work. And also, it's important to remember, you do not have to be Hispanic to be a part of this chamber, but it helps. It helps because a lot of our members are bilingual, and Dr. Groning is bilingual, as is Leslie, and I think Lance is sort of bilingual. He'll explain. But it's important just to understand, 50% of all of our members are not bilingual, and interestingly enough, the people that participate the most, maybe Leslie can tell us why this is, the people that participate the most in our chamber are not Hispanic. In general, Americans or people who speak English are more prone to networking. They're more prone to business sort of meetings and stuff. And Hispanics tend to be a little more reluctant to do so. I'm not really sure why. Maybe we'll talk about that during the Ask a Chicano segment of this program. But right now, we do want to welcome Leslie. Leslie, welcome to our show.
Thank you for having me.
And Lance, welcome to the show.
Thank you very much.
Just want to make sure that we inform you of things going on at the chamber. We have some events coming up that we want to make sure that you're aware of, and of course for our listeners as well. This Thursday, which is the day after tomorrow, we have a lunch at Vintage Park, as we do every week. Have you guys ever been to that lunch? You haven't been to that lunch yet, Leslie?
Not yet. No.
Okay, Vintage Park. That's on 249 and Luetta. I think you guys used to have, well, but one of the offices you manage, Lance, is around 1960, isn't it?
Actually, it's right off of 99 and Burnham Woods.
Okay. And what's the name of the clinic?
It's Times Square Dental.
Times Square Dental, and that's one that you also manage.
That is correct.
So your expertise goes dental and also medical, things like that.
Yes, sir.
Okay, so we have this luncheon. About 30 of our members show up to this luncheon, and if you're listening and you're one of our members, we'd love to see you. Basically, it's a networking lunch, so it's at Spring Creek Barbecue. We do that every week, and in essence, what happens is during the meeting, you get to talk about your business, and you get to share, hopefully, experience with others. One of the biggest things we tell our members always when they're there and when they're not there, I'll tell you that this is what really matters to us, is that when you show up to meetings, never show up asking, always show up helping. All right? So don't go to a meeting and say, I need help, or I want you to hire me. Rather than that, what you want to do is get into the frame of mind that I'm here to help you. So you guys have a Rolodex. Do you know what a Rolodex is? What is a Rolodex? I think she knows.
I know.
She just bought one.
I just bought one for my cards.
Okay, so you gave up on your iPhone or something, or what?
Yeah, I'm old school. I guess I like the hard book and the Rolodex, so I can just quick access, get it. Phones sometimes die. So it's just...
Phones sometimes die. Yeah, I'm charging mine with your charger, so they do sometimes die. All right, so you went backwards a little bit. A Rolodex is a place where you keep all of your cards. Mm-hmm. So we ask you to bring that to your meetings. Don't leave them in your office. In other words, all of your contacts are very valuable to the people you're doing business with. So the more you open your Rolodex and help others during meetings, the more valuable and attractive you are, the more people want to help you, and the more they want to give you business. So we tell our members, if you show up trying to do business on your own, you're making a big mistake. The average amount of people that all of us know, and you guys are going to know more, are about 200 to 250. That's the average. I would think that you guys at the clinic know a lot more people, right? And all kinds of different people. So that's what makes you so valuable to the membership, is that when you show up, you want to share the contacts you have. And that will make people want to bring their kids and their families to have primary care with the doctor. Right? So that's a big deal. We have this on Thursday. On Friday morning, we have two big events. One is going to be in Katy, and that is called Café Contigo Katy. Basically, it's a breakfast, and it's also a networking event. And there are about 25 to 30 members in the Katy area show up and, talk and eat menudo and stuff. And then we have another event here in Spring. It's Café Contigo Spring. Have you guys ever heard of Ella Springs? I think I mentioned it.
Yeah, I'm actually going to attend that one this
Okay.
Friday.
So it's this Friday. Now, you've gone to some of our events, Leslie.
Correct.
And tell me, what was your experience at the event you went to?
It was amazing. Honestly, I've never attended any Chambers event before. And then when you came, my neighbor, the Olori, actually informed us about becoming a part of the Chamber. And he's like, come on, just, come in for breakfast, just get to know them and, see how it is. And then if you feel, and Lance told me, he goes, if you feel comfortable, then, then we can network and kind of join. And I said, well, I've never done anything like that. And so he was like, go ahead and go. So I went, and everyone is very welcoming. They introduced themselves. Everybody was there to, get information, and very informative and what direction to go to. So that was something that's different that I've never been a part of, and it was interesting. So.
And there's a lot more, to go.
Yeah.
I mean, that was just one.
Yeah. I went also to the Monday morning motivation.
Yes.
Memorial Day, you had me working. I
Well,
was there.
We were all working. Big deal.
Yeah. So it was good. I got a lot of information that day, too.
Well, big deal is this, that when you're a small business owner, when you are on your own, when you're trying to make things happen, there are no holidays.
Yeah, I
It
see
doesn't
that.
matter what the holiday is, including Christmas.
Yeah.
If you can do work and if you can get ahead, then as a small business owner for the first few years, that's what you do.
Yeah.
Until you make
And
somebody else do it.
Yeah, I see that. And
So, well, you saw that in the members. I mean, they don't.
they were there too, with us in the morning, and talking to each other. And
Even the Oilery was there, right? Maybe he's listening. Who knows? That's Greg Zachary. And
Probably.
yeah,
if he is listening, we say hello to Greg for sure.
of course, yes, and his wife,
Joanna?
Awesome. Yeah.
Oh, for sure. I mean, she's
Yeah.
the reason why he gets to go out and goof around so much.
Because
you know.
she's really
there.
Yeah,
She's doing all the work.
Yeah,
Well, but in general, okay, so you come to some of the events, and remember, when people say hello to you, when people, are nice to you and things like that, they are that way because in our chamber, they are genuine for sure. I mean, I really do get that. They don't form cliques and they don't act like they're smarter or anything like that. But what really, I guess, their deep fear tends to be is, will Leslie tell somebody about me? You know what I mean?
Yeah.
So if you have somebody there that sells insurance, for instance, and you already have insurance, but you know people who might not have insurance, that's kind of how the networking thing happens, that you actually say to that insurance person, you know what, I think my sister needs insurance. I'm going to ask her, and if she doesn't have a carrier, I'm going to ask her to talk to you. Something like that, right? So that's how we do networking. That's actually how it works. When you go talk about business, that's the conversation that we want everyone to have. Who do I know that I can help you by talking to them? All right, so with that, on Friday, that's what we have, Café Contigo, and that'll be at Ella Springs. It's right here on 1960 and Ella. It's a senior citizens retirement community, and it's going to be awesome. We'll have 30, 40 people there for sure. On Monday, so 1 week from yesterday, we have Monday Focused Motivation, but this is the 3rd of July. Do you guys open on the 3rd of July?
No.
Okay, so the clinic is closed. What about the 4th?
No.
The 4th is closed. Okay, so see how that's good. So are you going to take a 4-day weekend off, Leslie, or what are you doing?
well, I actually work another job too.
Actually,
So-
Leslie will be working on the
But
3rd.
yeah, but that day I'll be working. The 3rd I'll be at the office.
So you will be working, although it's going to be for somebody else.
No, it's they're at the office. Usually even though he's not there, patients call in for prescription refills, for authorizations, insurance, stuff like that. It's more of like you can say not the clinical aspect of it, but more of the desk part aspect of it for patients.
The administrative side.
Yeah, so that's what I'll take care of during those times that he's away. That's what I'm doing because people need refills and
Sure.
stuff like that. So that's what I do.
So you're not closed.
No, we're
But
not.
the doctor's not seeing
Yeah,
patients.
correct. We're
Right.
not closed, but the doctor won't be there. But I will be there
Okay.
to
Okay.
assist patients.
Got it. So that's the 3rd of July, Monday. We are having Monday Focus Motivation for sure. I mean, I'm doing it. And as many people as take off, they like to come in and hang out. The meeting that you came to, was it full? How many people were there? Do you remember?
I think there was about like 7 or 8 people there.
Okay. I don't remember.
Yeah.
Basically, it doesn't really matter, like I said, if it's a week, if it's a holiday or not. If it's during the week, if it's Monday, people show up. So there you go. All right. So that's our week. On Tuesday next week, I'm not positive because we just confirmed someone, but I can't announce her yet, to be on our show next week as our guest. So we want to thank Leslie Guzman and Lance Aaron of 1488 Family Medicine right here in Conroe for being with us. So, all right, so let me ask you then a quick question, maybe from you, Lance. You told me earlier that Leslie tends to be really passionate about working with Dr. Groning.
Oh, I think that when Dr. Groning came to us and well, the way that this office came to be was that Dr. Groning left 1960 and went into the ER business.
Uh-huh.
And when he decided he wanted to open up a medical office on his own, the first person that came to mind was Leslie.
Okay.
I mean, he couldn't think of anybody else he wanted to work there. And I said, well, maybe I need to bring her in for an interview. And he says, no worries.
Not even an interview. She went straight. Wow, you could have been a felon.
Yeah.
Probably are.
No.
No.
I'm just kidding. No.
Okay.
No, he says, no, you don't need to do anything. I'll call her.
Yeah.
Okay.
And
go ahead.
there she is.
And so she was hired without any kind of prior anything, really?
Well, we've all known each other for several years because Dr. Iglesias and Dr. Groning are both married. And, whenever there's parties or anything like that, we all get together.
Events.
Okay, so who's Dr. Iglesias?
That is his wife.
His wife.
Who-
Dental office.
And
Okay.
she is the 1960.
That's the office he used to run to.
There you go.
Times Square Dental.
Yeah.
So
But,
Dr. Gunther Groning is the medical doctor who runs and who is 1488 Family Medicine,
correct.
along with you guys. So if I call your office, I'm going to see Dr. Groning for sure.
Correct. That's one thing that we provide as a service to our patients. You won't be seeing a different physician. You won't be seeing a different PA. You have a consistency of a board-certified family physician with 21 years of experience. I have over 10 years experience in the medical field. I've actually gotten a lot of information and knowledge from actual people that's been in medicine, and with Dr. Groning, always foreseeing, making sure I'm doing what I have to do. That's kind of the step that we want to continue doing, especially for a small business aspect of it, as well as providing a service to a community that's growing. Conroe, I honestly never drove past the Woodlands, and now that I'm seeing it, it's growing so much.
Okay, so we'll talk about the growth of Conroe and what you guys are doing specifically for this community, because we know that one of the fastest growing, if not the fastest growing segment of the community is Hispanic. And even when people don't like necessarily to mention it, we do. We're a Hispanic Chamber of Commerce, and we're very proud. So we make no apologies for the fact that we're growing and that we're part of this community. The fact that you haven't come all the way up here yet is interesting.
Yeah.
So did you ever go to Dallas? Have you ever gone to Dallas, like up 44 or 45?
I've been to Dallas once. My cousin lived up
So you don't
there.
get out a lot, for sure.
No.
Okay.
I kind of stay in Houston.
Or you go down to Galveston, but you don't come north.
Correct.
Okay, all right. So, when we come back in a little bit, we'll talk more about that, more specifically about Dr. Groning and his past and where he came from. I'm here with Leslie Guzman and with Lance Aaron, 1488 Family Medicine. This is Dr. Carlos Sanchez with the Hispanic Chamber Connection. We'll be right back.
Lone Star Community Radio is looking for those who are interested in hosting their own talk show. With monthly and weekly slots available on Conroe's FM 104.5, 106.1, and on irlonestar.com. Start your own podcast, create your first YouTube channel, and be on TV. Contact Lone Star Community Radio online at irlonestar.com or call the message line at 936-647-3776 to take your first step into the radio world.
And we're back. This is Dr. Carlos Sanchez with the Hispanic Chamber Connection radio program for members of the Woodlands-Conroe Hispanic Chamber, Katy Hispanic Chamber, the Galleria Hispanic Chamber, the Vintage Park, and the Heights. So there's 5 Hispanic Chambers of Commerce, all of which are under the one mothership Hispanic Chamber, the Texas Gulf Coast Hispanic Chamber of Commerce. That's the nonprofit that houses all these chambers that have each. Right now, we have in total about 240 members, 250 members in about 1 year of life. And like we said earlier, about 50% of those members are not Hispanic. When people ask me, Carlos, why aren't your members Hispanic? I say, because the market is not Hispanic only. We don't just buy in Hispanic places. We buy in American places, and Americans buy from us. So one of the bigger things is that folks that speak only English or folks that are mostly American still want to consume Hispanic products. They like Hispanic foods. They like us, and we like them. So that's why we're not an exclusive club, and I think that's what a lot of people tend to make a mistake, or where there are Hispanic chambers or Hispanic organizations where they're supposed to all be Hispanic. They only speak Spanish, but that's so exclusive that to me that's a big mistake, because you don't live in Mexico, or you don't live in Venezuela. You live in the United States, where everybody is one, right? So that's why we welcome both American and non-American citizens, or language, English, Spanish, or we even have people who speak Chinese and other things. So we are admittedly and very happily and very proudly a diverse Chamber of Commerce, unlike other chambers that I've gone to, where they've told me that they're all the same. And I look at the board of directors, and of course the board of directors is all the same, but all the people there are not all the same, because people are not the same. Right? So there you go. That's the explanation to the Woodlands-Conroe Hispanic Chamber, or to all of our chambers of commerce. We're here with Lance Aaron and with Leslie Guzman, and they are both with 1488 Family Medicine. Leslie is, I'm going to say this incorrectly, Leslie, what's your title at the clinic?
I'm the clinical manager, so all the
clinical manager.
Yeah.
And Lance, you
General manager.
The general manager. So you oversee not only this clinic, but a few others.
Yeah,
that's
okay. Correct.
They're very good. So basically, you're in charge of a lot of the business decisions for the clinics?
I try.
Okay. and Leslie, what about you? You're in charge?
I'm in charge of all the clinical, all the ordering, x-rays, laboratory, intake for patients, and all that. All the clinical aspects.
So when people come to an appointment to see the doctor, they basically see you first.
Correct.
Okay. And then you
basically, we kind of get their intake, kind of see when they come in. Main thing is we want to focus on getting them established with the primary care. We do allow walk-ins as of right now, but most of them don't have primary cares, and we kind of inform them that Dr. Groning can become a primary care physician to them, and then once they understand that they can have all those services there, we provide on-site lab, on-site x-ray, and all those services to the patient.
So primary care physician, I mean, he is available to do things like that.
Correct.
You said that you have right now, you're admitting walk-ins.
Correct.
Go ahead, Nancy.
I was just going to get to that part. People normally either call in and set up an appointment, or they walk in. It doesn't matter, which way they want to come in the office, but we do take walk-ins.
So what about urgent care?
Urgent care is the same as,
Sometimes you don't walk in when it's urgent care. You run in.
Yeah, well, regardless, Dr. Groning also works in the ER, so he is able to treat for lacerations or anything of moderate. Of course, if you got anything more severe, then we will have more critical aspects. There's steps that we need to follow, but Dr. Groning does have the expertise to have all that on site as well.
Okay, so primary care is one of your bigger focus areas.
Correct, because on that Main Street 1488, we do see a lot of urgent care providers, and a lot of
providers,
like a lot of clinics that are just urgent care, but don't provide a primary care service, which means to establish care for hypertension, cholesterol.
Some of a long-term type.
Correct,
thing.
and Dr. Groning will be able to provide that service.
Okay.
And they end up having to send them to us when they go over there.
I see. All right. So to make an appointment to see you guys, Leslie, what number do they call?
936-270.
Slowly. 270.
8008.
That was very good. 08. Okay, so it's 936-270-8008.
Yes.
And I understand Dr. Groning is bilingual, even though his name sounds German. Talk to us about that. What's that about, Leslie or Lance?
Lance, you want to?
I mean, he does have family that is from Germany, but, you know, they immigrated to Cuba.
So he's
So
Cuban.
He is Cuban,
Mhm.
and I don't know how far back that goes, but you know, he ended up coming to the U.S. in 1999 through a visa, so through Miami,
Sure. Well, that's basically where everybody comes through.
right? And then he and Dr. Iglesias ended up spending the next 10 years in New York, where
Okay.
she went to NYU, and he went to Montefiore for his residency there. She had a business there before they moved here to Houston in 2010,
Okay.
and she started that business in 2011. Her at Times Square Dental. So they also have two children, which are 10 and I believe 6.
Okay.
Andy.
So
and
let's go back. Dr. Groning is Cuban.
he is.
He's bilingual.
He is.
He's, of course, obviously from Cuba, came here on a visa through a lotto system. Married Dr. Iglesias, lives here now. Yes?
That is correct.
What is the percentage of people you see that speak Spanish in this area? Is it pretty high here in the clinic?
I can say we have a few.
Half.
Just a percentage?
Half.
Just-
Half.
Okay.
Like
so
half,
There you
yeah.
go. That's not a few.
There's-
That's a lot of people.
Yeah.
Okay, because that's your advantage. That's your edge. That's your difference.
Yeah.
That's why it's a benefit to work in the Hispanic Chamber of Commerce, because you get exactly this kind of reflection.
Well,
you know?
we get, because what happens is we get the referral of the mom and then the sister and then the cousin.
Sure. Why? What is that? Why do you smile when you hear things like that?
Because it's a good feeling. I would like for that, that's the best way to continue in providing that service to that patient, by having a service to the patient, by having a reference, by, hey, I got good service,
Sure.
And
We
I
create
actually
value.
saw an ambassador from the Chambers of Commerce that brought his wife, and that to me gave me a good feeling.
Really?
Yeah.
I won't ask you why or who, because that's
Yeah, of
against the law.
course.
But it doesn't matter.
But
I
to
think
me,
I know who
honest-
it was. I'm kidding.
No, but to me, that's awesome, that to get that reference, and have them come through and give them that service, that I know that that I did my job, Lance did his job, Dr. Groning did his part, and for her to leave with a smile and be happy.
Well, I know that some of our members are sending all their kids now to you, and they're really supporting you. And that's part of a bigger benefit of belonging to a Chamber of Commerce, that people who belong to chambers, if they're behaving the way they are meant to, as a good chamber member, they
Yeah.
will support each other. And what that means is that they take their Rolodex and they open the Rolodex.
But that's family too.
That's what we all have to do. That's why we have this program to tell our members, come on, guys, if you're not supporting each other, then you're missing it. Right? So that's a big deal, and I'm really happy for you. I'm glad that's actually happening. One thing I did want to mention for you, Leslie, because Lance mentioned it earlier, and we kind of stopped talking about it really quickly, but your passion for this business and for this industry and for this stuff, how long have you been in this industry now?
I'm going on 11 to 12 years,
Okay,
actually.
okay, and you're
Right?
well known for
Yeah.
being a very passionate advocate of
medicine and helping people. I guess because of my mom also, she suffered through MS too, and knowing that I can help her out, and at the end of the day, you want to be able to do, it was funny, we were talking about discussing of what is a success for you, and I said success is being happy in what you do, and I love what I do, and is helping people. Well, be passionate about medicine, if I can say, if somebody's family member comes to me and asks me questions, I'll try to answer as much as I can or address them in the right direction. And you don't have that anymore. People want to just go to work and just go to work, and that's not what it's about. If you're in medicine, you want to be able to know that, hey, my mom came to you, my aunt came to you, my cousin came to you.
So if you worked in a hospital, could you do what you do now?
Yeah.
The level of customer service, could you provide it?
Honestly, it's a little more, it's harder to provide it because it's a more faster pace, I can say, in a hospital setting, and you have more patients to but I don't think that,
parts.
but to be honest, the genuine of a person doesn't define that. You can still be pleasant and nice and
Oh, sure,
caring,
sure.
that doesn't change.
Well, what I mean, I guess, is the amount of time you spend with the patient.
No, it would be different.
Right,
of
you're not
course.
allowed to spend this much
No,
time.
not as much time.
If someone doesn't understand what the ailment is or whatever, it's harder for them to get the right kind of attention.
Correct.
But that's something that some hospitals I know are working on correcting.
Yeah, they're
no.
actually trying to fix a lot of that. And a lot of the hospitals, what's happening too, they've noticed a lot of the population that come through the emergency room or the ED that they don't have a primary care. They don't have. They go in and they have all these issues that present themselves at once, and then they don't know who to go to.
Sure.
And so that's why we want to make sure that they know that, hey, we're available here. We can come here and we can provide services to kind of address them in that right direction, so they don't be floating everywhere.
What do you mean? Say
Like
that
a
again.
service, like let's say the person comes in with severe hypertensive, but nobody's ever diagnosed it.
Okay, let's just say this. I walk in because I can't breathe.
Through the hospital, let's say.
I say, I'm having a problem.
And then they find out in the hospital you have
Just go with diabetes and all kinds of stuff.
blood pressure issues, and they ask you, do you have a primary care physician? They're like, no, I don't like going to the doctor. That's
Right.
basically the response
Okay.
you get a lot of the time.
Everybody uses the urgent cares now.
Well, because they know. You guys have to take care of them. Emergency care, you have to. And the other ones, it's a whole bureaucratic process.
Yeah, and so
And it's going to probably get worse. I don't know.
yeah, and so
Depends.
then you're in there, and then you're getting seen, and then when you leave, you're like, okay, what do I do
Now
now?
what? Uh-huh.
Now what? And that's what we want to let people know, that we're available. Dr. Groning can see them.
So let me ask you this. What does it take to get a primary care physician then?
Just
Just call and set up an appointment.
And he'll do like a workup and tell you, okay.
Correct.
And does that mean he keeps a file on you, or what does that mean?
You know, if they have insurance too, it's covered at 100% most of the time for the initial.
Yeah, and a lot of people don't understand that when you have insurance, they cover a wellness exam at least once a year. So finding a primary care physician, even if it's not with us, just in general, find a primary care and get established and get that wellness exam done through your insurance. Most of insurances do cover a wellness exam with a primary care at 100%.
What about no insurance?
We try to make things affordable for everyone. We work with anybody that wanted to do it. I'm sure that they could make it work with us.
Okay.
Because we take in consideration everything when we look at a patient. When we look at that patient.
That's good. Don't worry, Lance.
Thanks.
You're
Thanks.
cool. Okay, so if I have no money, no insurance, but I have a job and I kind of have a way of getting money, you guys will take that into consideration. You at least let me see the doctor, even if it's just for a wellness exam.
Yeah, Lance actually has developed a really good self-pay system.
Okay.
So patients can come in at a more convenient cost.
Self-pay. Let's talk about that just for a second when we get back from this break. We're going to take a commercial break real quick, and we'll talk with Lance Aaron of 1488 Family Medicine and Leslie Guzman of 1488 Family Medicine here at the Hispanic Chamber Connection radio program. We will be right back.
Our talk shows and music shows are looking for sponsors. Want to expand your brand awareness? Reach the hyper-local audience in Montgomery County? Lone Star Community Radio sponsorships accomplish this. Want to see our stats and rates? Check out irlonestar.com/sponsor for more information. Or call in and leave us a message at 936-647-3776 with your question. Get seen on TV or YouTube and heard on our podcast, FM, and internet radio. Sponsor your local radio station with Lone Star Community Radio.
And we're back. This is Dr. Carlos Sanchez, Hispanic Chamber Connection radio program for members of the Woodlands-Conroe Hispanic Chamber of Commerce. I want to make sure we give some shout-outs to some of the people who are members that are outstanding members. Of course, we already said Greg and Joanne Zachary. I mean, they're your neighbors. Do you guys ever, have breakfast together, breakfast tacos or anything, or no?
I always go say hi and get their oil.
Okay, so you guys, you have offices. You're right next door to each other. The same strip mall right here in Conroe. And so they're very friendly, very good people.
Yes.
Also, Celeste Gomez, who's one of our members, she's a friend, and she's also a sponsor of this program. And just wanted to say hello. I think they may or may not be listening. I'm not sure. Ask a Chicano is a segment of this program. Ask a Chicano. The word Chicano, what do you think the word Chicano means, Leslie?
I don't know.
Okay, you said it earlier, so that's why I
Yeah,
asked
I
you.
know.
Okay, so what does it mean?
Chicano living in Conroe.
Okay, so but the idea is this. The word came from a guy, his name is Andy Glass. Andy Glass is the husband of Becky Glass, of Becky Glass Insurance. Okay. Basically, he's a gringo. He's a guy who's worked all his life out in Conroe and who understands and actually gets the Hispanic culture. he came up with that name, Conroe, and that's the first time I'd ever heard it. So every time we mention Ask a Conroe, we say, thank you, Andy Glass, for the name. So now we know. Right? So a lot of people come to our chamber, and they bring all kinds of different and really interesting things, and of course that was Andy Glass. So we're talking here to Lance Aaron, who is the business manager for the 1488 Family Medicine Clinic and others. And we were mentioning, Lance, that from time to time people do show up at medical facilities who may not feel well, or who just want to figure out what's going on with their bodies and don't have money and don't have insurance. Let's say they don't have insurance. Maybe they have a few dollars. How does the clinic, how do you guys help those people out?
Dr. Groning wanted to set his business model up on creating value and meaning for his patients. And one of the ways that we try to create that value is to allow people who don't have health insurance to come in and get it at what I do is use like a 40% discount for those patients, which helps them get in and see the doctor. And if you look at what we get from the insurance companies, that's just like a network price that I would get from Aetna or Cigna, and it's a big discount for them, and it usually allows them to come in and get the help that they need or the service they want.
Okay. And do you guys ever travel? Do you guys ever like a mobile type situation where you go to health fairs and things like that, or not really?
We do fairs. One of the things that we're getting involved in is the schools to do those kinds of fairs, we also do health fairs, which we're connected with some of the apartment complexes that are near the office, which we'll do those like twice a year, which we go over and do BMIs for them. Also, just education for the.
I didn't know apartment complexes do health fairs. I've never heard of that. I lived in apartments for a long time, and they didn't care. I guess now they do.
Well,
I think that this
these
group
are different.
This group is different because most of the people that live there are in their mid-20s to 30s, and their business, working their way up.
Right. So they care, or what do you mean?
They seem to.
They have we actually were invited to do the Montgomery shelter adoption for the apartment across the street, and we were a healthcare provider that was there to them, and we helped sponsorship with that, and we gave bags to the people that
like goodie bags and stuff. Okay,
goodie bags to everybody that adopted. So I can say that apartment complex is a little more involved with the community as well. So I guess we asked them if, since we're new to the community, they actually came and welcomed us in the beginning, and so we did the same thing back.
Okay, so if we have people here listening who either run schools or are part of a school board of directors or something like that, are those people that would be interesting for you guys to talk to? Is that for the establishment of some of these fairs? How do you get involved with like the Conroe ISD? How would you get involved with them?
PTA usually is how I go about getting involved.
So if there's a PTA person listening, they would call 936-270-8008. Yes?
That's correct.
Okay, so we'll go ahead.
Yeah, and one of the other things that we did is go through the nurse in the school to see if there's things that they need.
Okay.
That's another way that we kind of the way that Dr. Iglesias set hers up is we would go and set up training for our education programs for the kindergartners and first graders.
Right.
And we would do that every year, and we would teach them, how to do, proper hygiene for them.
For their teeth.
Yeah, that's
okay,
correct.
So in this case, the doctor would teach them what?
Well,
or would it be you teaching, right?
We're going to have to brainstorm that because this is new to me, the medical side of it. So I'm going to have Leslie help me develop some kind of program.
For sure. In Spanish, too.
For the kids. Yeah, that's true. Yeah.
I've met the nurses right down the street of the elementary school and some of the daycares. And the main thing is, like, when they have kids that are sick or kiddos that are sick, one of the things that parents, of course, when they get called from work, they're like, oh, man, where am I going to take my child?
Right.
And that's one of the services that we told them, that they can bring them into the office and we'll be able to assist them with that.
So if they're brand new then, if like the baby is brand new sick,
we try to do one and up. That's one of the things that we did advise all the nurse and everyone at the...
One and up.
One and up is what doctor.
Okay, so let's just say I have a 2-year-old. I can bring my child in to talk to. Would that be like a walk-in then if they have no insurance?
Yeah, it can
I mean, like a
walk-in.
regular consult, right?
Correct, doctor. That's one thing that's the value that Lance was to put into the practice, that you're able to walk in and get that convenience for the patient, that you can be seen.
Does that mean that other clinics, similar clinics, don't do that? Or because I've never, I know one. Let me tell you guys this. I went to, this is a few years ago, to one of those emergency clinic places, and they had me sit. I was with my wife then, and she was sitting in a little room for at least an hour and a half, and they insisted she was pregnant. She was never pregnant, but they had to, are you pregnant? You must be pregnant. And she had another issue. It was food poisoning. But they kept looking for different things to administer. In the end, we spent about 3 hours at that clinic, and a big giant bill. But all the bill was for all the tests they ran, which we knew were not necessary, So it was a real waste of time for us to go to this place, and mainly because we don't know who they are. They were not real compassionate, things like that. I know that you guys are the opposite of that.
Correct, and that's one thing that we want to and that's why we need to educate more the community. You need to understand that finding a primary care physician, you won't have to go anywhere. You could just go to your primary care, and then if that's something that we need to establish to a different level of care, then we will address you to the right direction. Like the main thing that when I talked to Lance, and I can tell you from a personal experience that just happened recently, we had a patient came in, routine physical. There's nothing that came in, and of course we went in and we did labs, x-ray imaging, and then if something did come up, we addressed it to the proper specialist, and they went straight to the specialist presenting all her results. That being said, the patient established care with a primary care, and that's a lot of problem that these patients are not doing. Establishing care, they're just going into urgent care. Oh, I'm sick, I'm going to be seen, which is fine when it's after hours and you work, but when you have a condition that presents itself, who are you going to go to?
Okay, so why do you think that is, though? Why are people not going for a primary care?
I think it's education. To me, because a lot of these people do have health care that covers at 100%. And, it doesn't make, and plus they're young, so they have that feeling that.
Are you saying us old-timers don't count, or what is this?
I think the older we get, the more we get interested in our mortality.
We have to understand it at some point.
Yeah. And, the younger group doesn't do that. And,
Okay, so do you think the younger groups are not being educated by their parents? Is that where the thing starts? That as a child we don't
No,
get?
I think you're just busy. To be honest, people work, especially.
Too busy to have a primary care physician.
That's what the people are like. Oh, I'm too busy. I can't go to see the doctor. But the thing is, you have to make time for your health.
Okay.
And we are open on Saturdays too, which is a big deal.
That's a huge deal.
For a
people.
primary care doctor.
Oh,
For all
yeah,
these
that's
extremely
unusual.
successful and busy younger people. Come on,
Yeah,
guys.
my whole schedule was all packed this last Saturday, and I can tell you it's because most of the people worked during the week, so my schedule was packed.
What are your hours right now?
Right now, they shift because Dr. Groning is working ER medicine, but we are available on Tuesdays Mondays 2 to 6. Tuesdays we do like all day. Wednesdays we are closed because he does ER. Thursdays morning, Fridays afternoons. So
Wow.
it kind of shifts.
And
but
Saturdays
it's
morning.
Saturday mornings, but they
Okay,
have the availability.
Before
to see
you
the
say
doctor.
all that stuff, where can I find these things posted? Do you guys have a website?
Yes, we do have a website.
Go ahead.
It's www.1488 Medicine Group.
Wow, the whole thing?
I don't think it has group in it.
Let's just go with 1488familymedicine.com. 1488familymedicine.com.
Sorry.
If you need the hours of operations. Can I also make an appointment through your website?
Yes. Well,
It has a portal.
yeah, and you can request an appointment,
Right.
but I have to contact you to
Sure,
actually
for sure.
set it.
Okay.
But
So
you
it's
can-
better if I call, for
But
sure.
you can put all your demographic information in there, and then I'll, call you. It can make things quicker and easier if you want to go through the portal.
That's actually very recommended, I would imagine. When I go see a doctor, I hate sitting there filling out endless forms.
Well, I like you fill out the forms at our office.
Okay. Are they better, easier, faster?
They take about 10 minutes.
But if I go through your portal, your website.
You can't get them through the portal.
Okay, but I do get at least my name.
You can
Yeah.
put all your demographic information in there, your address, your
It's just a
insurance information.
comparison.
But when you actually do your health questionnaire, I like that to be done at the office. The paperwork that we have, it's tagged.
Okay.
So it's easier to do it in the office for me.
Got it. Okay. All right. So if someone wants to make an appointment, we already said the hours of operations vary because Dr. Groning is very busy. He's an ER physician as well. Which hospital does he work with here in the Woodlands?
Livingston.
Okay, so
So it's not in the Woodlands.
oh, sorry. Where is this doctor? I mean, this clinic of yours that you speak of, Livingston. Where is this?
You're talking about the ER, right?
Yes.
St.
Livingston
Luke's. It's with St. Luke's, I believe.
Memorial. We're not
Let's just go
exactly, we're not
Yeah.
involved with that. With
Yeah,
that end
that's
of the-
kind of like a whole different.
Okay, let's just go with he's
Yeah.
an emergency services physician. He also works somewhere else. Very busy. That's why if you want to make an appointment, you can make an appointment, and Lance or Leslie will direct you as to what time is best, to what time the doctor can
Yeah,
see
that's
you.
one thing. Even though our hours vary, just know that the physician will be there. Every
Right,
day.
when your
Yeah.
appointment is, it is.
Yeah.
And you guys are the ones that determine that. He's not the one that's going to say, okay, let me look at my BlackBerry and see if I have time.
No, it's usually we try to set it up to get the patients. I know we do late hours Mondays and late hours Fridays.
And next month, we'll be open every day, half a day.
Next month, that's August, July. No,
July.
it's August. But
We're
okay.
almost gonna be.
What am I
July.
saying?
July, we're going to be open 6
July.
days a week.
July is next week.
It's next week.
Was that what
Yeah.
you're looking at next week? Okay.
Yeah. So instead of being closed on Wednesdays, we're going to be open half day.
Okay.
So, we can see you every day except Sunday.
Okay. So as to not be confused, though, if I need to look at this carefully and closely, all I need to do is go to your website, 1488familymedicine.com, and I can look at it for the hours, but I can also call you at 936-270-8008. And one of the bigger requests of this clinic in general is, come on, guys, get a primary care physician, even if it's not Dr. Groning. You do need to have one.
Correct.
Because what if you're a parent, Leslie? I know you have some kids. Some kids. I know you have two, or
Well, you
Two
count
dozen,
my,
no.
my puppy too, so it's 3.
Okay, so you have several. If they don't have a primary care physician, how hard is it for you as a mother to work with your children if they get sick?
It's harder because then, like, right now, my kids, when they were infants, they had a pediatrician. Now they see Dr. Groning. But it's a peace of mind. Like, if my kids get sick, I know who I'm going to call directly. And then you get that convenience. Yes, sometimes things do happen after hours or at a certain times that don't. But at least you know that if they do happen during that time frame, you can see them.
So they always happen after hours.
Yeah,
Go ahead.
I think the after hours is the key to having a primary care physician that you can call on the weekend, and if something's going on, I can get you directly, him to call you back, and we can deal with your issues.
Well,
Like,
even if he's on the golf course and stuff.
well,
He doesn't play golf, I mean.
within 45 minutes or so.
Sure.
Yeah,
That makes
but I mean that's the thing that you get when you have a primary care is and they can also keep up with your medications, things like that.
Well, somebody that keeps your record and at least understands your health,
Yeah.
and what's going on with you.
Yeah, and if you can't do that with a urgent care.
And there's no cost to that.
No.
Okay, so
Actually, it benefits the insurance company, to be honest.
well, it benefits me, it benefits the patient for sure,
Yeah,
benefits
sure.
everyone.
Yeah.
Yeah, because I mean, you don't you don't pay so much out of pocket for establishing yourself with a doctor. Like it's a more cost efficient. Especially we all work, and so we gotta understand where deductibles are higher, co-payments get higher.
And it's nice to be able to call the office and say, look, Lance, I've run out of this medication. Can you do a refill? Yeah, more than likely.
Okay, so primary care physician for sure. If you're listening and you don't have a primary care physician, make an appointment. Come and see Dr. Groning. Call Leslie or call Lance. The number is 936-270-8008. And so outreach, guys, here in Conroe, as we discussed, it's growing very quickly. There's a lot of people who don't speak English in Conroe, as Leslie alluded to earlier. She was driving around and said, who are all these people? So what kind of outreach are you guys doing right now? Are you planning any outreach in maybe even in Spanish and stuff like that up in this area? Because you are in Conroe. Your clinic is in Conroe, technically. So are you guys planning on doing stuff like that? Maybe going to the schools, talking to the churches, people like that?
Of course, as soon as the schools get back, we started in February was our first day.
Okay.
So, and by the time I got up and running, the schools were already out.
Sure.
So what we're going to do is, when the schools get up and running again, we'll get with the PTAs and we'll start some kind of relationship. And I try to keep it within like a mile or mile and a half of the office to concentrate our efforts and help with whatever they need.
Okay.
What we do with the dental office is we'll do like a rock wall every time they have their a fair or something like that. It's kind of our theme, and then any other needs that they need,
Okay,
they
very
can
good.
call and ask us.
All right, so we'll look forward to some things that you guys are going to be doing for sure. When we come back from break, we're going to talk about asking at Conroe some questions about all these people who don't speak English up here, and how you guys communicate with people who don't speak English, and how you do the intake process. So we're talking to Leslie Guzman and Lance Aaron, what am I saying? This is the Hispanic Chamber Connection radio program, and we'll be right back.
Our talk shows and music shows are looking for sponsors. Want to expand your brand awareness? Reach the hyper-local audience in Montgomery County? Lone Star Community Radio sponsorships accomplish this. Want to see our stats and rates? Check out irlonestar.com/sponsor for more information. Or call in and leave us a message at 936-647-3776 with your question. Get seen on TV or YouTube and heard on our podcast, FM, and internet radio. Sponsor your local radio station with Lone Star Community Radio.
And we're back. This is Dr. Carlos Sanchez with the Hispanic Chamber Connection. I'm here with two very interesting people, Leslie Guzman and Lance Aaron of 1488 Family Medicine. They represent and work with Dr. Gunther Groning. Dr. Groning is a bilingual physician, 21 years board certified, right here in Conroe. Perhaps not in the middle of Conroe. They're more in the southern part of Conroe, in the northern part of Woodlands. So it's 1488. That's where that is. But it doesn't mean that you can't pay them a visit, or you can't give them a buzz. Give them a call if you have any kind of questions. I'm sure Leslie and Lance are happy to answer your questions, especially those concerning primary care physician services. We were talking about the fact that most people don't have a primary care physician, and what that does to someone is it ends up with a person not knowing where to go and who to talk to about their personal care. It's almost like they have to rediscover everything every time they see a doctor.
Correct.
And it's surprising how many people come in that think they're healthy, and then Leslie ends up, or Dr. Groning ends up finding something.
Wow.
Because they haven't.
Let's go the other way around. Let's say it's amazing how many people think they're not healthy, and Dr. Groning is able to say, you're fine.
That's not
Maybe not that many people, but let's go with that's because you know
Well,
what?
I can tell you now that we've been open 6 months, I've been seeing an establishment in care where I saw a person's triglycerides change drastically since Dr. Groning became his PCP. His triglycerides were like super high.
Okay.
And he came in for his 6-month follow-up. We saw him first 3 months, and then we did a recheck, and it was improving. And then at 6 months, it was just such a drastic 360 from his lab work. So that's an amazing feeling, knowing that he's doing the proper care and is having the proper, and he's, like he said, he didn't have one. He just didn't go to a doctor. Now that he has Dr. Groning to come to, and we know the labs to order prior to, so we order the labs ahead of time, and then he comes in and discuss and consult, so it gives him that convenience. And for me to high-five him from a triglycerides of 8,000 to 10,000 to like way down to like a quarter of that, to me that's a great feeling. That means that I've done my job, Dr. Groning's done his job, and the patient's done more of a job.
So let me ask you this. That's one person out of maybe thousands of people that are out there who have high triglycerides and high problems with cholesterol and hypertension and things like that. The outreach portion, the part of us being able to reach out to even our members. I mean, we have 250 members. If we could talk to all of our members and say, guys, just get yourselves a checkup, give yourselves the basic workup, and make sure you're healthy. That's the bigger challenge I see that you guys might have, just getting it out there.
Yeah,
It's true.
It's true. I think it's hard for people to understand. Just take that time to just, a half a day of work, go and get, checked out,
Well, but here's how it works. And let me tell you this. I know that this is huge in our culture, the Hispanic culture, but it's like my car. I won't go see a mechanic until it breaks down.
Yeah, unfortunately, and that's what, that's how I have to explain it to a lot of our male patients. I said, do you like your car? You want to keep your car running? Let's, you do go for an oil change. You have to eventually, so why not do your physical once a year? You do an oil change, every 6 months? You can do a physical once a year. Just kind of make that into a routine.
Right.
Once you develop that routine, it's not hard to continue.
So
Average time for one of those is only an hour and a half.
okay. So you can come and do a physical in the morning, and you're done for the rest of the day. Now, you said you do lab work also. So if I wanted to check my cholesterol, I want to check all these things, you guys take care of that as well.
Correct. We do have on-site lab available, so you don't have to go anywhere. And that's one of the convenience that Dr. Groning wanted to provide to the patients.
Okay.
And that's one of the values that Lance was talking about earlier, that we want to be able to be of value to the patient.
Right.
And, they can choose.
So you have lab work, but also x-rays.
as well. Correct.
So, and that's another one of the things that are unusual about the clinic, yes?
Correct.
Okay, what's another one of those things that you guys have? You have a list of things.
Yeah, we even, he does urgent care, like let's say lacerations. Dr. Groning can
Got
assist
that.
with lacerations. I mean, all of the services we provide is very on-site for Dr. Groning to be able to assist with.
Okay,
We can do the same thing that the urgent cares do.
very good. Okay, and you do take urgent care patients, and very good. So we're talking to Lance Aaron and Leslie Guzman of 1488 Family Medicine. They work with Dr. Groning, but his first name is Gunther Groning, bilingual doctor, 21 years, board-certified physician. If you need anything from them, please call 936-270-8008. This is Dr. Carlos Sanchez, Hispanic Chamber Connection, signing off. We'll see you guys again next week. Thank you for being on the show, guys.
Thanks for checking out this podcast of Lone Star Community Radio, Montgomery County's community radio station. If you enjoyed this recording, make sure to check out our past shows online at irlonestar.com or their respective video or podcast formats on YouTube, Google Play, or iTunes. If you have any questions regarding the show, either it being about sponsorships or questions for the host, contact the station manager at dick@irlonestar.com or call the station at 936-647-3776. This show is recorded in downtown Conroe, Texas at the Lone Star Community Radio Studios, and Lone Star Community Radio reserves all rights to this recording and images.